The debate over Medicaid expansion has real financial implications for Ohio's hospitals. Our newsmaker, Claus von Zychlin, CEO at Mount Carmel Health System.
Hi, everybody. Good Sunday morning and welcome to Capitol Square. I'm Jim Heath.
And I'm Tracy Townsend. A very busy week in Ohio politics. We're going to give you a taste of all of it during today's show.
Yeah, we want to start with the latest on Medicaid expansion.
Yes, the Kasich budget would expand Medicaid for people living 138% under the federal poverty level. That's approximately 275,000 Ohioans. In addition, it's going to bring $13 billion in federal money to Ohio over the next 7 years.
But Republican lawmakers, as we've heard the last few weeks, are adamantly opposed, fearing that Medicaid could break the state budget. To discuss Medicaid expansion this morning, we welcome Claus von Zychlin, the CEO of Mount Carmel Health. Mr. von Zychlin, good morning.
Good morning.
Good to see you. Let's start with Representative Jay Honegger's point that we just heard there, that Ohioans voted on this in that Issue 3 referendum just a couple years ago. I think it was something like 67% of Ohioans said we don't like Obamacare. Does he make a good point that that Ohioans have already kind of made a decision on this? They don't want to touch more Medicaid?
Well, you know, I find it difficult to think of it in those terms because health care is something that everybody needs. And the problem is when you have people who can't afford to pay for it, how will they get health care? How will they be taken care of? We have a system, a national system called Medicare that takes care of patients over the age of 65. We have programs in place that take care of young adults, young children. But this working class, this middle group, that can be a very productive part of the community, of the state, and they can't get a hold of health care, they can't get access to health care. How are we going to help them be more productive and be a strong part of this community? So
do you feel like you are getting some receptiveness? Are lawmakers listening to what you're saying?
Yeah, I hope that we can get past some of the politics that are out there and get back to what we're really trying to do here, and that is, you know, as a country, we have a responsibility, I believe, we as non-for-profits have a responsibility to care for patients, care for our citizens that need health care. And I think if we look at it in the terms of how do we provide care to patients in need and take the politics out of it, it's the right thing to do.
So what are you hearing from your counterparts in states where hospitals are and states that are planning to take the money? What are you hearing from them in terms of how they've been able to get people on board?
Well, you understand that the Accountable Care Act is a very complex act that has lots of moving parts in the financials that are with it. We are getting cuts in the healthcare system through Medicare and other processes, and one of the ways that some of that money is being reallocated and redistributed is through the Medicaid expansion plan or through other ways to provide coverage for that population. And what we really are trying to do is create a new way of care. And I think in the state of Ohio, one of the positives that we have is that the Governor Kasich, has really developed a strong team with John McCarthy and Greg Moody, who really understand the ability to create a partnership between the provider community, the payer community, the patients themselves, and the government to change the way that Medicaid is provided. And that really allows us to create a system of care that will, in the long run, reduce cost and provide prevention rather than just intervention.
Mr. von Zychlin, conservatives have never really liked the concept of Medicare/Medicaid. In this debate, they're saying, look, this is all about long-term. We don't believe that program is sustainable. How do you answer that? Do you think that Medicaid and /Medicare at the federal level, these are sustainable programs?
You know, Medicare and Medicaid came into being in the mid-60s, and we've been refining them and changing them since the mid-60s. And I would say that with healthcare reform, moving from just purely intervention to looking at ways to prevent and population health, what we have today is the right step going toward how we change the way we deliver health care. Is it perfect today? The answer is no. But do I think we are on the right path with moving toward pay for performance, moving toward prevention rather than just intervention? The answer is yes.
And when you talk about prevention rather than intervention, can you talk about how hospitals pay for that charity care? I mean, do people who have insurance pay for that?
Yes, so we cost shift. I mean, we have to cover those costs. I mean, in central Ohio alone, I think it's something like $195 million of uncompensated care per year. that somebody's paying for that, right? That's through cost shifting, and when we look at cost reductions, we have to start looking at how we are able to continue to provide those services.
I toured one of your health centers. I believe there are 3 that Mount Carmel has in Central Ohio. I toured one of them earlier this week. I mean, what strikes me is that the working poor are really, as you pointed out earlier, the issue here, and yet they don't have a lobbyist necessarily down at the State House. I mean, I was looking at one statistic, Medicaid expansion, if we don't do it, more than 370,000 low-income Ohioans, working poor in Ohio, over the next 5 years will have no access to health care coverage and likely will be uninsured. So, I mean, this goes back to the question of then where are they getting their care, and I imagine a lot of it is the emergency room. And that has got to be, I think everybody can agree, if you use the emergency room for your primary care, that's got to be the most expensive answer of all, right?
Yes, the emergency departments are not designed to do that, but that's what, in fact, they are becoming more and more a part of.
And so if expansion doesn't go through, do we see that scenario getting worse?
Yeah, I think so, because also if you see cuts coming on the other side, things like our health stations become at risk because the funding goes away, right? And the thing with the emergency department, they deal with a specific issue. They don't deal with the holistic component of the patient, prevention, chronic disease management. They deal with a single episode, and that is the most expensive way to care for people.
Can you talk a little bit more about those health stations? I'm sure there are people who may not be familiar with how those work.
Well, they work on a sliding scale for patients. Those that are that can get in it, we subsidize those and provide a relationship with the church where they provide the space and they provide supports in different ways, and we provide physicians and patient care to do that. And it's a great partnership because we also get not just the pure clinical care for those patients, but we also get some of the social psycho things that go with it in helping package that to help those patients in many different ways.
You were down time-wise to about 6 more months until this federal deadline at the end of the year. Are you active at the State House? Do you expect Medicaid expansion to be a separate bill, and do you expect it to be one that they will consider for the rest of the year and hopefully have resolution at the end of the year?
Well, we certainly hope that we can get some positive resolution. I think the governor and his staff, all the hospital association, health system associate people are trying to find ways to support the expansion in one way or another. And given that now it's been moved into its own agenda, hopefully we can, between now and the end of the year, come up with the right scenario to help people understand how important this really is in the transformation that healthcare is going through.
Well, we will certainly be following that. We appreciate you coming in this morning.
Thank you so much.
Good to see you this morning.
Same. Thank you.